Welcome, dear listeners. You are listening to me, Barrister Tahir Ashraf. You will be very pleased to know that we have got a fantastic show lined up for you today. We are privileged, I must say privileged, to have as a guest who has been able to take some invaluable time out for us, telling us what things are like out there, particularly within the National Health Service. I am joined today by Dr. Shahbaz Afzal. Dr. Shahbaz Afzal is over in Lancashire, in the Lancashire region. Welcome to the show, Dr. Afzal.
Hi, Tahir.
So, I'd like to start off by first and foremost, I think it's now that in my show, this is the first time that obviously I've got someone here from the NHS. I'm just going to start by giving you and all of your colleagues at the NHS a round of applause to thank you all for the hard work that you guys are putting in. So I'm just going to take this moment.
Thank you. That's what we're here for.
So we are very grateful for people like you to do that which you do to help essentially save lives. So thank you so much for that. And thank you for your continued efforts in the fight against coronavirus, COVID-19.
Pleasure.
Now, the issues, you are aware of the issues far more than our listeners may, to take this opportunity to try and bust a few myths, as it were, and hear it from someone who's obviously qualified enough to talk about these matters. And I've got a few questions for you, which are obviously myths going around on the internet and so on and so forth, and various other points. Now, the first question I'd like to put to you is this. One of the myths is that the hot water doesn't kill the virus. Is that right? I mean, 27 degrees or something? What's going on?
Okay. The logic of it doesn't make sense. One of the aspects of this hot water is if you drink it, then you've got about 3 days for the virus to remain in the throat before it comes down and you can kill it. Okay. A virus does not sit there waiting for a couple of days in one area. The virus comes in, as we know, it's one of what we call an airborne virus. So it's in the air, so we can inhale it through our what we call mucous membranes, and it's straight inside. So hot water, you are not going to get the water hot enough to do anything to the virus without damaging yourself. So that's false information, I'm afraid.
Right, because some of the information we were hearing and listening to was that 27 degrees will kill it.
If you mean in terms of washing your hands, that's different. But if you mean in terms of the myth that's going around about drinking hot water or with lemon, then that's false.
Right, but hot water, drinking hot water and lemon, is that helpful in any way, shape, or form?
It might be. Nothing is majorly proven in that sense, but definitely not. If we're talking about COVID-19 specifically, there is no evidence to say that that will make any difference.
I see. Do you advise that people should drink hot water and lemon in any event, whether, COVID-19 aside?
Mhm. Myself, nothing in particular. They do say lemon is acidic, but you have to be careful. It's easy to say drink it because they talk about some health benefits, but the risk is anybody with reflux problems, indigestion problems, because lemon and other citrus fruits can be acidic, you can end up causing indigestion. So it's wrong for me to just say everybody drink lemon and hot water, if that makes sense.
There is also information out there to suggest that adding a bit of lemon to water in a morning or on an empty stomach essentially makes the water alkaline, and therefore that's helpful because the body will benefit from alkalinity for it to heal itself.
Okay, I think the most important message is, are you drinking enough water? That is more important. The body has something called homeostasis. The body will balance itself in whatever you do, whether it's food, liquid, your hormones, your temperature, your body will regulate itself, and it's got its own mechanism. So I think the key message is whatever you put inside it, I think the most important thing is, are you drinking enough fluid so that you don't become dehydrated, particularly because of a fever, which can be one of the symptoms, even if we went back to the virus.
Now, what's all this we're hearing regarding herd immunity? And that herd immunity essentially means that there's going to inevitably have to be thousands and thousands of deaths, or hundreds of thousands of deaths, for it to be effective without a vaccine. In other words, lots of people in the country have got to catch the virus before people develop immunity to it in some way, shape, or form without there being a vaccine available.
Okay. There's actually some confusion in that, because the term herd immunity is actually only really valid when you're talking about vaccinations. So herd immunity means that if you vaccinate 80, 90, 95% of a population, then you build an immunity so that you can wipe out, like some of the diseases in the past that we wiped out, hence why we have a really good vaccination program from the World Health Organization. With regards to this virus, the concept of herd immunity doesn't really apply. What we know is that the virus is going to infect many people. It is spreading, as we can see, at an immense rate. And it's not that you are trying to do herd immunity. What you're trying to do is actually, knowing that it's going to spread, how much control can you have over that spread? And that's mainly because of the demand on the NHS. So that if we have a peak, like some of the other countries like Italy did, are we ready to cope with that peak? So herd immunity is actually a slightly different concept.
A flawed concept in this context.
Yes. So you can't really use that concept. Similar with the vaccination, obviously it's difficult to comment on the vaccination because it's in production, there's some tests going on, but it's too soon for us to have a widely available vaccination that's going to make a difference overall. We've got to go in this for the long haul first.
Okay, so essentially what you're saying is that the concept of herd immunity is a misnomer here. That usually occurs and is far more relevant when it comes to an actual vaccine being available.
Yes.
And given that there's no vaccine presently available at the moment, although there are trials, for example, as I understand the position to be, Johnson & Johnson are in trials, Novartis are in trials with
a lot of the drug companies
in the US and so on and so forth. We've also heard all sorts of conspiracy theories and what have you. For example, that actually it's the pharmaceuticals and so on and so forth that are spreading this, and it's in their interest and so on. What do you say to something like that?
The interesting thing is, this is not the first time the pharmaceutical industry has been blamed. Whenever there's certain diseases, even cancers, things like that.
It certainly won't be the last either, will it?
No. Whenever something happens, somebody's got to take the blame. There's always, is it about money? What's it about? So the pharmaceutical industries, yes, they have a big influence on the world in so many ways. And the truth is, can we do without them? Can we do without medicine? No. Medicine has come a long way because of the pharmaceutical industry. So it's just one of them. It's another one of them things that there's plenty of conspiracy theories, and this is amongst them. But there's no obvious truth. Otherwise, hopefully, we'd be in a vaccination even faster than we are doing.
Yes. Well, because the information out there, certainly from political leaders and so on, and people in positions of authority and responsibility, would suggest that a vaccine, even if one were to be available sooner rather than later, you are potentially looking at anywhere between 12 to 18 months-ish. And if that estimate is wrong, if that guesstimate, should I say, is wrong, then you are at the very least looking at around about 12 months.
Yes.
Would you agree with that estimation?
Yes, them are some of the timescales that have been given. But again, things are changing on a daily basis. As the trials are going on, we will have better information and a time scale sooner than that. But don't expect the vaccine to sort out the actual issue, especially in the short run. So we can't rely on the vaccine. We have to rely on the other plans in place and the other procedures as to how it's currently running to see where that leads us whilst the vaccine is in process.
Okay, so insofar as you've moved on to a point insofar as placing reliance on other points, measures and so on that are in place. In the meantime, I do want to touch on that, but I'd rather touch on that in a moment, because I was reading an article in The Guardian, and that told me basically one of the other myths and so on, or I don't know whether it is or not, and I wonder whether you're in a position to be able to shed some light onto that.
Let's try.
There are WhatsApp messages and so on and so forth that suggest that an anti-malarial drug called, and I'm going to try this pronunciation, I'm no,
hydroxychloroquine, probably.
Exactly, hydroxychloroquine, and the similar compound, chloroquine, is used for autoimmune diseases such as rheumatoid arthritis and so on and so forth, and whether that is likely to be a potential cure.
There is trials. There's some quite promising trials going on. I've actually got some literature that I need to read and just what we call critically appraise, just to have a look in more detail. I'm also a pharmacist, so I have a background in medicine.
Sorry, I missed that. Sorry, we missed that. Could you just repeat that for us? So you've got some literature to read.
Yes, being a pharmacist, I've also got a background interest in medicines anyway, so I've got two reasons to look into it, and there is emerging evidence that looks quite promising, and its use in certain countries, that hydroxychloroquine alongside other medicines, even one of the statins that we use for cholesterol, have shown promising results against COVID-19. The problem is it's very difficult to have a full-on trial to prove this, and there's also some literature that says they've got really good results, but there's no proof from where that literature's come from. And
well, why is that? Let's just drill down on that for a moment, because on the one hand, there is some information floating about, and there are videos made by doctors and so on and physicians themselves that say, they hold up a chart or hold up a sheet of paper and say, right, this is the information, use this, or for example, do this, and so on and so forth. So whilst hydroxychloroquine is, if you've managed that, hydroxychloroquine is, I'm just showing off there, hydroxychloroquine is one of the medications used, and you've mentioned statins and so on. And obviously, you are someone who was a pharmacist first, and you've come to the treatment side, or this side, much later, having served as a pharmacist first. You're saying there are journals. Are they just articles, or are they articles in peer-reviewed journals?
It's not. It's because it's still quite new. There isn't enough information to say how, have they been peer reviewed. That's all ongoing, and I can't say for sure exactly, is it a 90%, is it 50% evidence base. All I know is that the big hearsay at the moment, or the big topic, is these medicines, and so a lot of countries are funding some sort of trials to see, okay, what effect does it have. The problem is most medicines, they have a benefit, but they can also have side effects and consequences.
Yes.
So there was an article recently about Africa, which uses hydroxychloroquine a lot because of a malaria problem, decided to actually withdraw, some of the countries decided to withdraw using it at the moment, because they were finding a lot of problems and a lot of side effects, which were causing more damage than actually just getting even a mild form of the COVID. So until more trials are done, there is no policy in place, particularly in the UK, to say we are using these drugs. We understand there's might be some new data coming through. So what the pharmaceutical industry and the Chief Medical Officer has advised is, and Public Health England that all talk to each other, is to let's keep our supply ready so that if the evidence comes, we're not going to do it without evidence. If anything comes, then at least we are ready to hit it hard with that.
So, insofar as evidence and trials are concerned, within the last certainly 30 days,
Mm,
there have been information coming out from the United States where people
yes.
have taken some sort of vaccines or they've been injected, or a number of people have, and these have been, what's the word? Not necessarily televised, but certainly published and shared and so on via social media platforms.
Mm.
Now, how far behind is the UK when it comes to trials?
The UK is not particularly more behind than other countries. Yes, it might be slightly smaller, but a lot of the large companies, Glaxo, Johnson Johnson, obviously they have a big base in this country. So I wouldn't necessarily class us as behind in that sense. It's just the stringency in this country compared to some other countries about how quick certain medicines might be fast tracked, which is all about patient safety.
Mm,
Um, Sometimes that can make it look like, are we behind? But there's also, particularly on social media, the problem is, as you mentioned, we've already gone through a couple of myths. There is that many myths and fake news, lots of
sorry,
fake
we seem to have
trials.
lost your signal there for a moment.
Oh,
Sorry, you were saying about social media, on social
yes,
media?
the problem is social media is, as we just discussed earlier with some of the myths, there is that much fake news out there, that much fake media. It's
Mm.
difficult to say who, it's difficult to even verify, is somebody an actual doctor? Is it a PhD? What is their role? And are they qualified to actually talk about a trial? Or are they someone that's just taken it on as soon as it goes viral? That's all it takes. It doesn't matter who the initial person was or who the initial source was. So it's very difficult with trials, and everybody is just waiting for a cure. Everybody wants that, okay, because of the fear. So anything that gives you a positive hope, truth or false, people make that viral. So it's in this day and age of social media and technology, it's very difficult to manage.
Okay, but the truth is indeed out there, and hopefully one day we will get to the truth of the
Mhm.
matter. And certainly
Hopefully.
we hope that we don't lose as many people as many other parts of the world. And with
Mhm.
that, we will go to a short commercial break, and we'll be with you right after these few important messages. Welcome, dear listeners. You are listening to Barrister Tahir Ashraf on Revive FM 94.0, London's newest radio station. Uh, Today, we are talking about coronavirus. But before we go there, I'm going to tell you where you can listen in to us. For those of you who have just joined us, you can listen in to us in any part of the world, provided you have got an internet signal. Yes, that's right. You can catch us on revivefm.co.uk. For those of you who happen to be driving in or around the East London area in particular, why not keep it locked on the 94.0 on the FM frequency? That's how you can catch us. But otherwise, why are you driving around? I hope that you are only driving around because it is important for you to do so. Or rather, as the government terminology and advice is, essential. Without it being essential, do not drive around random. You will be stopped, and I can assure you, you will far more likely to be getting a fine just for driving around as well. I have with me, I'm very grateful to be joined by Dr. Shahbaz Afzal. Dr. Shahbaz Afzal, thank you so much for joining me in the second segment. And thank you very much for enlightening our listeners to some of the myths and so on and so forth. So let's go right back into it. Before the break, we were talking about, for example, hot water, whether or not consuming and drinking hot water is going to help to kill the virus, to kill the coronavirus COVID-19. You have told us hot water drinking hot water on its own is not going to kill the virus. We were talking also about chloroquine and the fact that there are many trials going on. But let's just ask you one more question regarding the whole water side of things. And people are saying, well, for example, it's also advisable for people to boil a kettle and so on and so forth, stick a towel over the head and take some steam on a daily basis at least once or something, or possibly more if you've got the symptoms or as a preventative measure. What are your thoughts on that?
Sorry, just repeat that bit. I lost
So,
the reception.
forgive me. So people are saying, for example, that it's helpful for you to just boil a kettle, boil up some hot water, and do some steaming, take in some steam via the sinus, the nose, and so on. And in fact, many are going one step further and saying, well, you'd better add some, vapor
Mental
rub or
crystals.
something mental, indeed, into that. And I just wonder what you think of that. I mean, whether there's any truth in that or not.
Okay, simple answer for that. Very useful to try and unblock the sinuses if you've somebody that suffers with postnasal drip, rhinitis, or just general congestion. Absolutely no evidence to say it has any effect on the coronavirus, and I think it's as simple as that.
So, are people experiencing symptoms of a blockage in the nose and so on?
A blockage of the nose is not the typical symptom. The two typical symptoms, or the most common symptoms that I talked about, is the persistent cough, a new persistent cough, usually a dry cough, and otherwise it's a temperature. Them are the two main symptoms. You can have a general cold that can also give you similar symptoms, and that's normally associated with the nasal congestion or a runny nose or sneezing. So that's more likely that it's going to be just a cold compared to it being a potential coronavirus in that sense.
So I've come across information, for example, as indeed many people have, that because you're heating it up and because you're taking in steam into the body, and the virus needs heat for it to be killed. Do you think that the steam can be, inhaled in such quantities and so on for it to kill the virus? And has that, as a method, been considered by any hospitals or surgeries, or any information that you might have on that specific question?
Okay, the problem is, and I think because of the simplistic approach that's been taken, you don't simply inhale a virus and the only place it goes is here or the lungs. If it's going for the lungs, where's the steam going? You don't really steam the inside of your lungs. And what you're going to do about your bloodstream, what happens with viruses, bacteria, they get into your bloodstream. That's how we detect them. So what use is a bit of steam, even on this area, if the virus is inside? And it also depends on what we call viral load. How much of that virus have you taken on in that sense? How infected are you? So
Or
no,
how advanced, how much has the virus taken hold, rather?
yes. So no, it's a too simple analogy. There's nothing in particular in it. If it was as simple as steam can sort it out, I think the simple things would have been tried, and some things have been tried, but again, it's more of a hearsay thing, and that's why you will not find it on any Public Health England or the COVID-19 updates that are coming out on a daily basis. There's not. There's plenty of advice that people are not following that is proven to make a difference. The simple things like the social distance, washing our hands, isolation, shielding of the high-risk people. These are things that have been proven in other countries to make a difference. We're not doing them. We're trying to find new novel ways to carry on doing what we shouldn't be doing, and thinking there's a simple answer in, let's say, hot water or steam.
And making excuses, I think, is what you were thinking of.
And that, yes.
Okay, so steam is not going to help. Well, I suppose it might help with the dryness of the throat and the cough, as
Yes.
it were, perhaps.
But it's, yeah, the clear thing is, it doesn't mean you are going to get rid of your coronavirus by simply doing steam. You do have to remember that particularly for 80% of people, even if you get infected, it will only be what you call a mild illness. So you might feel shivers, some flu, the dry cough. So if you're going to get over that in 4 days, that's why the isolation period for a single person is the 7 days. Um, if you think about it, you might think, oh, I was drinking hot water every day. It's gone. It's gone because your body's immune system has now helped fight it off. It's taken that time. So it's difficult to sometimes say. So you can't always blame people for suggesting these things, but you've got to take some things, I don't know, with a pinch of
With a
salt
pinch
or,
of salt, yes.
yeah,
Yes.
or think, is there any scientific background?
Or evidence, as it were, for that matter.
Yes.
Okay, let's take this to the next step, and so it might just be that boosting the immune system is helpful, and so on. And obviously, the strength of the immune system means that you've been able to fight it within that 4 or 5 or however day long period.
Mm.
How long a period is it from the point of experiencing symptoms for you to then be able to come out the other end or deteriorate? So presumably there's, like you said, presumably there's a 4-day period, is there? So on day 4 or 5, you might deteriorate or you might get better.
Yes, it's very, every single person is individual from that sense. What we
Yes,
say
yes.
is, if the virus has an incubation period of what we say 7 days, then it kind of,
Sorry, you cut out there.
oh, sorry. If we're looking at what we call the incubation period, so what they're saying is usually you will, even if you get it and you get some symptoms, by day 7, you will usually be back to normal, or you can say that you don't have the virus any longer. Okay?
Mm-hmm.
Or so it's very difficult to say, are you going to be affected on day 4? We're finding how things are going at the moment. You assume that it was only affecting those with a lot of what we call comorbidities, lots of other medical problems, poor health, or the elderly. Whereas, as we are finding in the news recently, that
Mm-hmm.
even younger patients, fit and healthy patients, are actually unfortunately losing their life, and it's
Yeah.
difficult to explain. So it's not a simple characteristics one to say, right, everybody will get affected on day 2 or 3.
Yes.
The majority of people, the figures that are being used are 80% of people will just have a mild form.
80% of those who are infected with it,
Yes,
who catch the virus.
15,
Yeah.
15% will have more of an effect and show more signs. And it's the 5% that it's what we call more fatal and life-threatening when it can affect them. Them are the kind of figures.
Right. Okay. Still troubling and still disturbing figures
Mm.
on any reckoning, given that this thing has taken hold of several thousands and thousands of people, and in fact
Mm.
hundreds of thousands of people across the globe.
Oh.
I just want to ask you about the test side of things, because you've said the virus doesn't just sit in the throat, it doesn't just sit
Mm.
in the sinus, and it doesn't just sit in the throat. Obviously, once it's in, it's presumably, to understand, to help everyone understand things better and to dispel the myths, as it were. It's not going to be stuck and sitting there in your nasal passage or in your sinus. As it goes in, it's in the bloodstream. And because it's in the bloodstream, and secretions are then made from the bloodstream because your body's system, is that right? Can you explain that process to us a bit more? And how, for example, if someone who's, what's the word, who's caught the virus, unfortunately,
Mm.
sneezes, and if I were to breathe that in, how that would affect me, and how then I can sort of, impact or rather potentially infect another person. How is it that
Okay.
it works? Just explain that, because obviously people think it's there and so on. And I'm looking specifically, potentially, to hear from you in respect of
Okay.
the blood side of things.
I think
And then,
to keep it simple, I think the simplest way is different viruses infect in different ways. When we call this an airborne virus, it means you've got some, yes, you can do a nasal swab to test inside the nose because you will get a certain amount of virus in the nose. That doesn't mean it's only in the nose, but it uses your secretion, saliva, uh, when you sneeze, the vapors in the air, when you cough, what we call respiratory wise, breathing, coughing. So it's amazing. There's videos out there you can watch even on things like YouTube on how many droplets of germs are spread with one sneeze or one cough.
Mm-hmm.
Okay, so that's what we mean by the airborne. So that if you cough, you are passing parts of that virus all over to, and it's amazing, especially in a closed room when there's no ventilation, how far that spreads. And because some of these particles are so small, we're talking microns, like invisible to the eye, they can remain floating in the air for hours after. I was
Mm-hmm.
watching one of the Chinese studies that showed how long it remains airborne.
Mm-hmm.
Hence why the social distancing, the isolation, it's not a simple case of just keeping the distance. You have to stay out of that environment because we don't know how much of it is around in the air, depending on who's coughed or sneezed and who's not covered themselves, obviously using the correct technique. So
Mm.
that's so, and basically, if you inhale that in, what we call mucous membranes, that's why we're talking about anyone that's a high risk wears eye protection because your
Or a
eyes are
shield.
what we call permeable. Yes, yeah, the shield type goggles, something to protect your eyes, to protect your face, hence why the mask. Um, Even the skin, because you don't know if you might have a cut. We know that it's the whole process overall is saying do that so that you might be at risk of transmitting, or obviously the virus getting inside you. So airborne is the word, and it's all about covering your mouth basically.
Mm. Okay, so on the question of airborne,
Mm.
how long is it? So I've sneezed, say, for example, 5 minutes ago. How
Mm.
long is it floating in the air, and how long is that air in that area a danger to somebody who's walking by?
Okay, if you're outside, it's very difficult to measure because it all depends on wind speed, uh, if it's an open space.
Yeah. So say it's indoors, for example, in a shopping area or something, because
Mm.
naturally we still need to get out and about to go and do our essential shopping.
Well, if you've got no ventilation, then that from this study that showed sort of like infrared, looking at the particles and how far they spread and how long they were there for, even a few hours after, it was still showing that these particles are so tiny, there's hardly any density to them, that they were still floating hours later. How scary is that?
Mm, that's really hammers the point home. So much so that really you shouldn't be going out
Unless it's essential. Yeah, definitely.
unless it's absolutely essential. Yes,
Mm.
I follow. Okay, so insofar as taking some protective measures and what have you are concerned, I mean, I'm conscious that we are now approaching a break, so we've got about 2 minutes or a little under 2 minutes
Okay.
now before we get to the next break. Tell us about the sort of precautions that you are advising people to take, including the washing hands. Um, because I
I
think
think
we are going to have to explore the washing hands a little bit more after the break as well. But very quickly, what's the logic behind that? Because if I've caught it and
mm,
through a sneeze,
mm.
why am I being told to wash my hands?
Okay, because of it's not just from sneezing, it's not just from respiratory. As we know with germs, you can watch any videos on that. Germs are spread in many ways. Okay, same with the virus. We know it can remain on clothing, cardboard. Hence why we were talking about deliveries and things like that. It can remain on all materials for different lengths of time. So it's all about reducing the risk of transmission of germs in, and particularly with this virus, because we know of how long it can remain on materials. So you are minimizing the risk of passing it on to somebody else who might not have the same immune system as you for various reasons, and
Mhm.
so the virus will have a more drastic effect, hence why we're seeing the increase in hospital admissions.
Okay, we are approaching a break now. So after the break, we'll talk a little bit more with Dr Shahbaz Afzal about what sort of precautions we all should now be very much used to now. We should be taking, we should have developed these habits. And we'll talk about that all important advice concerning washing our hands and maintaining hygiene right after these few important messages. Welcome back, dear listeners. You were listening to Revive FM. Rather, you are listening to Barrister Tahir Ashraf on Revive FM 94.0, London's newest radio station. That's right. You can catch us in any part of the world, wherever you have an internet signal. Yes, that internet signal is very important for you to be able to catch us. What's the address? The address, of course, is revivefm.co.uk. Now, usually I would say, as I have been doing, if you happen to find yourself driving in and around the East London area, no, I'm not going to say that. Or rather, what I will say is if you happen to find yourself driving for an essential reason in and around the East London area, then you can catch us and tune in to the FM frequency on 94.0 on the FM frequency. That's where I want you to keep it locked. If you are indoors, why not log into the internet, have us on in the background, listen to us, and this is where I would like for you to keep it locked. We have got this session with Dr. Shahbaz Afzal being a part of this show. Thank you so much for coming here, or rather, thank you so much for taking out the time to give us the information. Let's go right back into it. I mean, before the break, we were talking about washing our hands. Why? Why should I wash my hands? I've sneezed, or rather, I've caught the virus because of a sneeze. I've breathed it in. Now, I can have a mask around my face so that if I were to sneeze, the droplets are caught by the mask covering my face. Why should I then be told to wash my hands continuously? How does that arise?
I still find it a strange concept that even in 2020, we actually have to emphasize washing hands, having to talk about hygiene, which is something simple that we should be doing already. It's something that we should have already been doing. It's an amazing thing that we having to go into so much detail about it. But as we mentioned before the break, it's all about reducing transmission, especially in areas where there is more than one person, whether it's families, whether you're out and about. Everything that you touch, you are transmitting germs, skin cells. So to reduce the risk of transmission, it's been proven that, particularly because, as we mentioned, the virus can stay on materials, on yourself for different lengths of time, depending on the material, then one of the most imperative things that have been proven to work is to wash our hands.
Okay, washing our hands then for 20 seconds with soap. Some soaps don't foam up. Why can't I use dry soap?
It's normally about the detergent types, the ones that actually have a more cleaning effect. There's nothing, when you say dry soap, what do you mean by dry soap?
I mean, for example, people have been going on holiday and so on and so forth, and there are soaps out there which you could use to wash your clothes and so on. They're dry, so you don't need water.
Okay.
But the advice here is wash your hands with hot water and obviously use soap for a minimum of, they say wash your hands with hot water for 20 seconds. I mean, semantically, that's not clear enough. To me, being a barrister, the way I see it is scrub your hands with soap for at least 20 seconds. And then after that 20 seconds, once your hands are fully foamed up and so on and so forth, make sure you've got that 20 seconds. You either sing happy birthday or you can count to 20 slowly and then wash your hands under the hot water tap or something.
Fair enough. But if you make things too complicated, people are not going to do it or they're not going to do it right. You've just kind of doubled the time in that sense.
Well, I don't know. Okay.
No, the simple advice is you can do everything within them 20 seconds as long as you've covered the areas. And that's why if you look at the World Health Organization, who we call WHO, if you look at their method, which looks at the front, the back, covering all these areas, which are the kind of things that we in hospitals always do. This is how we are told to wash our hands, to use sanitizer, to do the same thing, so that we are covering every single nook and cranny of the hands and the wrists. So what we're trying to do is relay that same information in a more bite-sized, easy form for the public, because if you make it too complicated, people will do it wrong, people will get fed up, and people might not wash their hands. So I wouldn't worry about the semantics and the exact detail. The most important thing is the 20 seconds, happy birthday, whatever song you choose. It's just an idea, and it's just something to try and make it catchy. And it seems to have sort of like progressed in that sense. And a lot of people have followed that. And as long as the message is, if we can increase the number of people washing their hands at every opportunity, that's the basics of it. So don't worry about the exact soap. The fact that you're using soap is good enough. Whatever you have, if you don't have soap, not everybody's privileged enough to have soap. As long, you know, not everybody's privileged enough to even have hot water. So let's make it simple. Whatever you can use to try and clean your hands and avoid unnecessary touching, so that you're all doing your part to reduce the transmission. Let's keep it at that.
Okay, fine. So washing our hands is essential. Hygiene is essential. In other words, that I think is the key takeaway from that. Because there's this thing about washing your hands every 20 minutes, or is that just wrong?
Nothing's wrong if you can do it every 20 minutes. It just means you're doing it at such a frequency where you're very unlikely to transmit anything. There's nothing in particular that says has to be 20 minutes. Depends on what you're doing in them 20 minutes. You might need to do it after 10 minutes, such as when we're at work. We have to do it in between every patient. Anything that we do, we will have to wash our hands again, or at least sanitize them with some hand gel. So depends on what role you're doing, where you are, as to the frequency. So there's no point thinking, if you told someone you have to do something every 20 minutes, that sounds like a chore. How many people are going to follow that? But if we say at any opportunity or any time you are at risk, even using door handles, because that's a simple way of transmitting, then just try and use a common sense, or just try and think, okay, have I come into contact with something that other people have? So should I be cleaning my hands at the appropriate opportunity?
Okay, let's now ask you about something else, which is another myth. Or is it? Or is it? Yes, I'm afraid so. Apparently, people are using 99.9% isopropanol alcohol and so on and so forth with some aloe vera gel and so on to be able to make their own hand sanitizers and so on at home. But obviously, that has its own consequences and problems and issues with it. So, what's your view on that, and what's your advice or take on that?
Okay, I think to keep it simple, I think the easiest way is we do not have, although there was another panic like with some of the other items in supermarkets, there is plenty of hand sanitizer, particularly now, available again. Yes, 2 weeks ago we might not have been saying that. So sometimes I'm wondering why somebody's trying to make their own and why they want to go for something higher than what everybody else is using. It's not just your own germs. You've got to think about, if nobody else around you is doing it, you are not any safer unless you stay in your own environment. The disadvantage to my from a medical point of view is you have to be careful with what you're using in terms of sensitivity, in how drying it can be to your hands. So yes, you're adding the aloe vera, but there's there's nothing in particular that says it has to be this particular percentage or this is how it has to be. So I think just use the ready-made products, make it keep it simple.
Yeah, because as I understand the position to be, if you were to try and make your own ones at home, you're not going to get the quantity and the mixtures right. And of course, alcohol in of itself has a drying effect on the hands and therefore causes crack, which means absorption-wise. Can you tell us a bit about the the fact that you might well just expose your hands, which might get, invisible cracks, as it were.
Yes, and alcohol has a drying effect. We know when in hospitals having to use the alcohol gel on a frequent basis, you often get drying hands. And if you don't use emollients or moisturizers frequently, um, dry, cracked skin, the skin is one of our main protective barriers, okay, against infection, against viruses, against germs of any sort. So if you've got even what you call the micro cracks or any sort of dry skin, you're lowering your first uh,
Line of defense.
line of defense. That's the word. So why do that? You're defeating the object of
Mm,
trying to make things
thank you,
better
sir.
when actually having a consequence.
Mm. Okay, so that was another myth that we have busted, that the homemade sanitizers aren't necessarily good. In fact, they could well cause detriment to your skin and so on, and therefore it's far more wiser, particularly in the current climate, for you to be using those ones that are available off the shelf. Uh, you've already addressed the concern that people have had in respect of the lack of availability that we have had around the time where the Prime Minister suggested, right, we now need to stay at home as much as possible, and so on and so
Mhm.
forth. So 2 weeks ago, but at the moment, you say that's not the position. You say that's not the position. Obviously, you're a doctor in the front line, as it were. You still need to see your patients and so on. Have you been able to go to do a shop, as it were, going in and out of work and so on and so forth? Have you seen that for yourself, or is that the government line that you're
Um, I,
advancing?
I lost reception at the start of that question. Sorry.
So, what I'm saying is that you're in the front line. You're a
Mhm.
doctor in the front line. You've still got to go see your patients and so on and so forth, deliver a service, and help fight this battle against COVID-19 for us,
Mhm.
as it were. You're in the front line. You've said that hand sanitizer and so on is available. We don't
Mhm.
have the shortages that we may have experienced a couple of weeks ago around the time that the Prime Minister said stay at home. You say the stocks are now replenished. Do you say that by virtue of a government line, or do you say that having experienced it yourself in some way, shape, or form, particularly having gone out shopping?
Going out shopping hasn't really been easy for many reasons. One, it's just having the time. And obviously, because of panic buying, the queues, I don't have the time or the luxury in that sense to go out shopping. So it's been very difficult. But I was actually in the shops today, 20 minutes, and things have gone a lot more peaceful, and all supermarkets are using the social distance rule. So it's really good to see how things have changed.
Hmm.
Stocks, there was pretty much most things in stock. The whole
Hmm.
panic buying has now got under control, and hence why
Thank God for
the
that.
government line was that, look, we have enough. We are privileged in this country to
Yeah,
have
yeah,
enough of
yeah, yeah,
everything.
yeah.
So the whole panic buying, the whole hoarding, it hasn't got anybody anywhere. Um, so, so no, there isn't a major problem. I've been offered it even from other friends and family who say, look, they've seen it in supermarkets. If I don't have time, do they need me to get some? Um, I've not needed it, but because I've already got my own supply from using it on a daily basis, and all the workplaces have
Mm.
it in. So I wouldn't say that's a particular issue at the moment.
Okay, we are running very quickly out of time. I'm afraid we've got about a minute or so to
Oh,
go
wow.
of time. So, very quickly, in about 30 seconds, if you can give us your a few tips and what you would say, what you would like to say, what precautions you want people to be taking when they're in the house, when they go out shopping, and so on and so forth, whether it's wearing full sleeves and whatever tips you've got.
Okay, I think this the key points are the ones that the government is emphasizing on a daily basis: washing your hands, social distance, isolating as much as possible, stay indoors unless it is absolutely essential to go out, and unless you are a key worker. And together, this way, we will minimize the spread of this. We can't prevent it, but we can minimize the spread and the impact. And it's not to ourselves. As youngsters, we feel, or the younger population, we feel we're invincible or this is not going to affect us. No, it might not affect you, even though things are changing there. It's the effect that it might have on members of your family, such as your parents or grandparents. So, so just don't be selfish and think about other people, because we are in this together and we will fight this and get through this together, particularly with our NHS.
Thank you so much for taking the time, Dr. Shahbaz Afzal. We are very, very grateful for you to have taken the time for us to give us your words of wisdom, to tell us about what your experience is on the front line and so on. We hope that our listeners found that extremely helpful. We would very much like to wish you the entire safety of the world. We'd like to wish you, and we hope that you stay safe. And we'd love to have you back on the show. And on that note, I'm afraid we have run out of time. And thank you so much once again. And there you have it, dear listeners. I've been Tahir Ashraf, Barrister Tahir Ashraf, and you're listening to Revive FM.